Welcome to The Cancer Signal, a podcast presented by GRAIL where we tell the stories of multi-cancer early detection testing. I'm your host, Susanna Quinn. Today, we welcome Dr. Nima Nabavizadeh, an associate professor of radiation medicine at the Oregon Health and Science University, as well as the chief medical officer within the Cancer Early Detection Advanced Research Center, CEDAR for short, at OHSU. Dr. Nabavizadeh has a specialization in the treatment of gastrointestinal cancers, lymphomas, and hematologic malignancies. And he, as his title suggests, is at the forefront of early detection research initiatives, serving as the principal investigator for a multitude of cancer early detection clinical trials. One of those clinical trials is the GRAIL Pathfinder 2 study. Dr. Nabavizadeh, we are honored to speak with you today and learn more about this exciting and innovative study. Welcome to the Cancer Signal.
Great. Thank you so much for having me.
We are recording this episode just ahead of the European Society of Medical Oncology, the ESMO 2025 Congress in Berlin. GRAIL presented data from the Pathfinder 2 study. Before we dive into the results, could you give us some background on Pathfinder 1 and what was learned from that study?
Pathfinder 1 was a first of its kind interventional clinical trial looking at the safety and feasibility of the Galleri multi-cancer early detection test. That study provided, number one, safety information to allow us to feel comfortable to move forward with further clinical trials in larger prospective populations. The original Pathfinder study also showed that the Galleri MSET test was able to identify novel cancers which do not have any kind of cancer screening methodologies for. And the Pathfinder study really provided us with an initial glimpse at the test metrics for this Galleri MSET study that then the Pathfinder 2 study, which we'll be talking about today, helped kind of further refine in a much larger representative use population.
Could you give us an overview about Pathfinder 2? How was the study set up? Who participated? And what was it looking to find?
Yeah, the Pathfinder 2 study is a multi-institutional interventional study examining a broad population of over 35,000 participants within North America over the age of 50 who do not have a clinical suspicion of cancer. It's a cancer screening study. And its goal is to determine the safety and performance of the Galleri multi-cancer early detection test in this representative population, so that we can detect many cancers before symptoms appear and when they're easier to treat.
What was the most significant outcome from Pathfinder 2?
Yeah, so the Pathfinder 2 preliminary results, which we presented at the ESMO annual meeting, was for the first 23,000 participants on the study that had a one-year follow-up. And we identified a signal positive rate, or out of those 23,000 patients, about 1% had a signal positive test showing a clue or indication for cancer that required further workup. Furthermore, this test was found to be highly specific, meaning that we avoided false positives at a great degree. The specificity was 99.6%. And what that means is really this test did a great job at minimizing false positives and unnecessary workups for folks that did not have a cancer. Furthermore, the test found a positive predictive value of 62%. And what this means is that this test, the results of this test, especially a positive result, is something that both providers and patients should take seriously because the test is meaningful. And a positive test has a 62% chance of indicating a true cancer. And in comparative terms, positive predictive values of our normal cancer screening methodologies, such as mammography for breast cancer and colonoscopy for colon cancer, those positive predictive values are 10% or less, meaning that both providers and patients are used to dealing with these types of false positives. But what was really impressive about the Pathfinder 2 results is really this high positive predictive value that is meaningful.
And was there an extra sensitivity to the more deadly cancers in the test?
Yeah, so in this 1 year follow-up, sensitivity was found at 12 months was found to be 74% in a pre-specified subgroup of 12 cancers responsible for nearly two-thirds of all cancer-related deaths. And when you loop in all of the cancers that we know of, the sensitivity at 12 months was 40%, showing that there really is a complementary value in providing multi-cancer early detection tests on top of our kind of standard screening methodology, such as colonoscopies, mammograms, low-dose CT for patients with high risk lung cancer, who are high risk for lung cancer.
And of course, it detects cancers that we don't generally screen for.
Absolutely.
Dr. Nabavizadeh, could you talk about some of the most significant outcomes from Pathfinder 2?
Absolutely. In the Pathfinder 2 study, we found that the Galleri multi-cancer early detection test detected approximately 7 times as many cancers when added to U.S. Preventive Service Task Force A and B guideline recommended screening tests. And those are for breast cancer, cervical, colorectal, and lung cancer. And just over half of Galleri detected cancers found were at an early stage. Furthermore, the study found that Galleri triples the number of cancers detected when added to U.S. Preventative Services Task Force C recommendations. So that now includes prostate cancer. So when you include our screening test for prostate, breast, cervical, colorectal, and lung, adding the Galleri test triples the number of cancers detected. And the test is especially sensitive to many of the deadliest cancers that are typically caught too late, such as pancreatic cancer, liver cancer, and ovarian cancer. And about half of Galleri detected cancers are found at an early stage.
It's just incredible. Can you explain to listeners why this is significant and to whom this is significant?
Yeah, absolutely. The Galleri multi-cancer early detection test really helps fill an unmet need to screen for deadly cancers for which we don't have current screening methodologies for. So who is it significant for? I would say it's significant for the general population, which is really what the Pathfinder 2 study was aimed at examining. So this, again, these are participants over the age of 50 who really have no clinical suspicion of cancer. These are normal, healthy patients looking for cancer screening opportunities.
Could you talk about what a CSO is and what we learned about it in the Pathfinder 2 study?
Sure. So yeah, whenever a clinician, such as myself, the principal investigator on the Pathfinder 2 study, gets a signal positive finding for a participant, there's a result of there's a signal that there's a cancer within this patient that we need to identify, and on top of that, the Galleri multi-cancer early detection test is able to identify where that signal is coming from through the epigenetic changes on the DNA. And why that's important is that it provides the physician some type of guideline on where to look and where to hone in the diagnostic workup, rather than looking throughout the whole body for a cancer signal. The cancer signal origin result on the Galleri test provides clinicians with a framework on how to really maximize the diagnostic workup to minimize the amount of time needed to find this cancer and to hopefully reduce waste in that cancer workup as well.
Let's dig into the numbers around sensitivity and PPV, positive predictive value. Can you explain what these terms mean and what the study found for both?
Sure. So PPV is the positive predictive value, and again, this is a metric that helps build trust in the test, telling the physician and the patient that the results are meaningful and should be taken seriously. So in the Pathfinder 2 study, the PPV for the MSET test was almost 62%. And what that means is that a patient with a signal positive finding has a 62% chance of ultimately being diagnosed with a cancer. And again, this positive predictive value far outshines the positive predictive values that we're used to right now with colonoscopies and mammograms, which are in the 10% or less range. So this is a really important, meaningful metric for clinicians and for patients. The sensitivity of a test refers to how many cancers are able to find within the general population. The sensitivity at 12 months was 74% in a pre-specified subgroup of 12 cancers responsible for 2/3 of all cancer deaths. And the sensitivity, again, at 12 months was 40% for all cancers. What's notable about the Pathfinder 2 study is that we're not finishing follow-up at 12 months. We're going to continue follow-up for all these participants for up to 3 years to really hone in on what the true sensitivity of this test is.
To help put this in context for listeners, how does this compare to existing standard of care cancer screenings?
So, U.S. Preventive Service Task Force has level A or B guideline recommended screening tests for cervical, colorectal, lung cancer, and breast cancer. And these tests have a high sensitivity. They pick up on a lot of true cancers, but their specificity is not as high as their sensitivity, meaning that false positives are inherently a part of cancer screening for most patients. I provide an example. A woman in her 50s who is eligible for all four screening modalities has on a yearly basis around a 40% chance of having one of those tests be a false positive. And that is something that has a lot of impact and cost, both psychosocially and in regards to potentially unnecessary workup and diagnostic harm. The specificity of the Galleri test is very high. It's 99.6%, meaning that the number of false positives are very low. Less than 1 in 200 people who receive this test get a false positive finding. And why that's important is that it provides some trust in the test. It may minimize harm for patients. And something else that was notable out of the Pathfinder 2 study is that less than 1% of all 25,000 analyzed patients, less than 1%, so about 150, had a protocol-directed invasive procedure. So 99.5% of people who received the Galleri multi-cancer early detection test did not undergo any kind of diagnostic harm with any kind of invasive procedure. And I think this is a meaningful result for this test to provide some comfort to both providers and patients that the results are meaningful and should be followed up on. And one thing I want to add too is, the sensitivity, by design, whenever you're, creating a new cancer screening test, there's always a balance between sensitivity and specificity. And by design, the specificity of the Galleri multi-cancer early detection test is high. And what that means in turn is that the sensitivity is limited to some degree, which brings the point that this test really is not meant to replace the standard of care screenings that we know, such as mammograms and colonoscopies, but to be used complementary to that. Mammograms and colonoscopies have a very high sensitivity, which is why their specificity struggles. And the Galleri multi-cancer early detection is basically another screening modality to be used in a complementary fashion to help screen for those cancers that we don't have other screening methods for.
Thank you. Thank you for clarifying that. That's important. Safety was a primary objective in Pathfinder 2. What did you learn about the safety of the test?
Yeah, I mean, like I mentioned previously, because of the high specificity and because of the high positive predictive value, largely because of the high specificity, the number of patients that had to deal with a false positive finding were very low, and only 0.6% of all patients had a protocol-directed invasive procedure, and the invasive procedures were even greater for the folks that were eventually found to have a cancer. So if there's a clue for a cancer, there's then maybe an imaging finding that shows a potential cancer in some organ. Certainly, you got to imagine that participants are going to be undergoing invasive procedures to biopsy those lesions. But again, what was very reassuring about Pathfinder 2 study was the overall safety, and that less than 1% of people had a protocol-directed invasive procedure.
Amazing, truly. Are there any other learnings from this study that you'd like to share with us?
Another finding from the Pathfinder 2 study was the time to diagnostic resolution. And what that means is the the time interval between a signal positive finding that I, as the principal investigator, receives and relates to the patient to the time that we conclude all imaging, biopsy, specialist workup to prove whether or not a cancer does exist within that participant. And what was exciting about the Pathfinder 2 study is that the median time of diagnostic resolution was 46 days. And why that's significant is that, you know, the whole goal here is early detection. And if you identify a cancer, you want to try to get to diagnostic resolution, and you want to get to a point of cancer treatment as soon as possible, because, you know, days and weeks our cancer is growing and cancer is shifting from an early stage to a later stage. And having a diagnostic resolution of a month and a half, I think, is very favorable and really speaks a lot to the study teams and the coordination the study teams brought and the level of dedication that the clinical research coordinators and the PIs across the Pathfinder 2 study invested into this study.
Particularly when you're talking about such fast-growing cancers like pancreatic and ovarian, diagnostic resolution is so important to be fast.
I think this really kind of opens up a really exciting chapter in cancer screening. You know, so many people are diagnosed with cancers way too late, and only if we had one test that attempts to screen for cancers would we be able to really make a difference when it comes to both mortality from cancer and tolerability of cancer treatments. And, you know, as a radiation oncologist, early detection is paramount. There are many cancers that I treat both in early stages and in later stages. And without a doubt, cancer treatment at early stages are more tolerable and are more successful. And, you know, the Pathfinder 2 study showed that the Galleri multi-cancer early detection test has a possibility of bridging that unmet need of cancer screening for all these cancers that we're really kind of flying blind with.
Certainly, the idea that we can catch so many more cancers at an early stage is really probably our best weapon at fighting cancer at this point.
Yeah, and what's exciting too is, you know, there's, you know, having enrolled the most amount of patients on the Pathfinder 2 study, over 6,000, we have a lot of experience at OHSU in regards to working with patients with signal positive findings. And I'm hopeful one day we'll be able to share the stories of these patients who we've found early stage cancers treated in a curative fashion, who are now leading normal lives and really kind of outspoken about cancer screening in general. And it's just really exciting, and we're just kind of we're just touching the surface right now in all this.
Thank you so much. We here at the GRAIL podcast are trying to share the stories of so many patients who have caught their cancer early stage through the Galleri test. We really appreciate you joining us today and sharing these findings.
Thank you for having me.
Listeners, be sure to visit GRAIL's YouTube channel to watch this episode there. We will link to it in the show notes for this episode. This is the Cancer Signal presented by GRAIL. Please subscribe so you don't miss an episode, and thank you for listening.
The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended in individuals who are pregnant, 21 years old or younger, or undergoing active cancer treatment. Galleri does not detect a signal for all cancers and should be used in addition to routine cancer screening. False positive and false negative results do occur.